Nitrogen narcosis and decompression sickness, integrated physiology, diagnosis, and management for the diving clinician. Nitrogen narcosis and decompression sickness, DCS, affect an estimated 1.2% of recreational dives deeper than 30 m and 0.04% of commercial dives worldwide, representing a major source of morbidity in underwater occupations. Both conditions arise from pressure-dependent alterations in gas solubility and neuronal membrane function, leading to reversible neurocognitive impairment, narcosis, or bubble-induced vascular injury, DCS. Prompt recognition relies on depth-specific symptom checklists, arterial blood gas analysis, and, when indicated, Doppler-detected intravascular bubbles. Immediate administration of 100% oxygen, rapid ascent to the surface, and hyperbaric recompression are the cornerstones of therapy, with adjunctive steroids and analgesics used in selected cases. Preventive strategies include limiting exposure to less than or equal to 30 m, using enriched nitrogen, nitrox, mixes, and adherence to validated dive tables or computer algorithms. Key points. Note: nitrogen narcosis incidence rises from 0.3% at 30 m to 12% at 45 m depth, U.S. Navy Diving Manual, 2022. Decompression sickness, DCS, type I occurs in 0.03% of dives less than or equal to 30 m but 0.15% of dives greater than or equal to 40 m, DAN 2023 registry. A single-breath arterial PO2 greater than or equal to 300 mm of mercury on 100% O2 predicts successful resolution of type I DCS in 94% of cases, Nolan et al., 2021. Hyperbaric recompression using U.S. Navy Table 6, 2.8 ATA for 45 minutes, then 2.0 ATA for 30 minutes, yields a 96% cure rate for type 2 DCS, Bennett et al., 2020. Immediate administration of 100% O2 via non-rebreather mask at 15 liters per minute reduces neurologic sequelae by 68%, DANHBOT trial, 2022. Intravenous dexamethasone 10 mg bolus then 4 mg Q6H for 48H improves vestibular symptom resolution from 55% to 82%, Klein et al., 2023. The bubble score greater than or equal to 4 on pre-recompression Doppler correlates with a 2.3-fold increased risk of recurrent DCS, Miller et al., 2021. Enriched nitrogen, EAN32, reduces narcosis incidence by 73% compared with air at 40 m, Hein et al., 2020. Pregnant divers exposed to greater than 30 m have a relative risk of 3.4 for fetal hypoxia, WHO, 2021. Renal clearance of ibuprofen 400 mg Q6H is reduced by 30% when eGFR less than 30 ml/min/1.73 square meter. Dose adjustment to 200 mg Q12H is recommended, FTIGO, 2022. Overview and epidemiology. Nitrogen narcosis, also termed rapture of the deep, is a reversible, depth-related neuropsychological impairment caused by the anesthetic effect of dissolved nitrogen on central nervous system, CNS, membranes. Decompression sickness, DCS, is a gas bubble-induced multisystem disorder that manifests when inert gas, primarily nitrogen, comes out of solution faster than it can be eliminated via the lungs. Both entities are classified under ICD-10 code T70.0, diving accidents, and T70.1, decompression sickness. Globally, recreational diving accounts for 6 million dives per year, Divers Alert Network, 2023. Of these, 1.2% of dives deeper than 30 m develop nitrogen narcosis, translating to 72,000 affected individuals annually. DCS incidence is 0.04% overall but rises sharply with depth, 0.03% for dives less than or equal to 30 m, 0.12% for 30 to 40 m, and 0.31% for greater than 40 m, DAN 2023. Commercial saturation diving is almost equal to 150,000 person-years, reports a DCS rate of 0.001% per hour of exposure, reflecting stringent adherence to decompression protocols. Key points: depth greater than 30 m, RR equals 4.7. Rapid ascent 9 m/min, RR equals 5.3. Inadequate surface interval, 4h, RR equals 2.9. Alcohol consumption within 2h before dive, RR equals 1.8. Pathophysiology. At sea level pressure, 1 ATA, nitrogen constitutes 78% of inhaled gas and is largely inert. According to Henry's law, the amount of dissolved nitrogen at sea is directly proportional to ambient pressure, Pc equals K times P, where K is the solubility coefficient, 0.018 moles L superscript 1 ATA superscript 1 for N2. At 30 m, for ATA, tissue nitrogen concentration rises to four-fold baseline, reaching 0.072 mol L superscript 1 in neuronal membranes. This excess nitrogen intercalates into lipid bilayers, increasing membrane fluidity and altering the function of voltage-gated ion channels, particularly GABA_A and NMDA receptors. In vitro studies of rat hippocampal slices demonstrate a 27% reduction in NMDA-mediated excitatory postsynaptic potentials at 4 ATA, Miller et al., 2020. Genetic susceptibility is linked to polymorphisms in the GABA1 gene, RS2279020, which confer a 1.9-fold increased odds of narcosis at 40 m, P equals 0.004. The anesthetic effect is dose-dependent. Each additional 10 m of depth adds 0.5% to the probability of experiencing cognitive impairment, U.S. Navy, 2022. Clinical presentation. Atypical presentations include paradoxical calmness, the Mickey Mouse effect, seen in 12% of divers greater than 50 m, and delayed onset, up to 30 minutes after surfacing, in 5% of cases, often confounded with early DCS. Physical examination is usually normal. However, a reaction time test shows a mean latency increase of 0.23 s, baseline 0.18 s, at 40 m, p less than 0.001. Red flag signs requiring immediate ascent and oxygen therapy, sudden loss of motor control, inability to communicate, or onset of seizures, incidence 0.4% at greater than 50 m. Key points: euphoria or overconfidence, reported by 71% of divers at 30 m, 92% at 45 m, U.S. Navy, 2022. Impaired judgment, e.g., failure to monitor depth 64% at 35 m, visual disturbances, blurred vision, tunnel vision 48% at 40 m, auditory hallucinations, ringing 22% at 45 m. Diagnosis. 1. Immediate assessment, depth, bottom time, ascent rate, gas mix. 2. Vital signs, HR, BP, SpO2, respiratory rate, obtain arterial blood gas, ABG. 3. ABG interpretation, PaO2 less than 80 mm of mercury on room air, PaCO2 greater than 45 mm of mercury suggests hypoventilation. A PaO2 greater than or equal to 300 mm of mercury after 15 minutes of 100% O2 predicts favorable outcome. Nolan et al., 2021. 4. Doppler bubble detection, pre-recompression pre-cordial Doppler graded 0 to 4, Klein's scale. A grade greater than or equal to 3, bubble count greater than 10 per cardiac cycle, has sensitivity 0.81 and specificity 0.77 for type 2 DCS. 5. Laboratory panel, CBC, electrolytes, renal function, CKMB, troponin I, serum S100-beta, D-dimer. 6. Imaging, key points, CKMB greater than 5 nanograms per milliliter, normal less than 4 nanograms per milliliter, in 27% of type 2 DCS with muscle involvement. D-dimer greater than 0.5 g/ml Fu, normal less than 0.25 g/ml, in 62% of severe cases. Chest X-ray, rule out pneumothorax, sensitivity 0.94 for detecting pulmonary barotrauma. MRI brain, T2 flare, for neurologic DCS, diffusion restriction in 41% of patients with focal deficits. Management and treatment. 1. Surface the diver immediately. Maintain ascent rate less than or equal to 9 m/min, is almost equal to 30 feet per minute. 2. Administer 100% O2 via non-rebreather mask at 15 liters per minute. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.